Assalamualaikum warahmatullahi wabarakatuh. Welcome guys, I'm Nasrawati. I'm from class C and I am an English education student. Today we'll be discussing aphasia, a condition affecting a person's ability to communicate. We'll explore its causes, symptoms, types, diagnosis, and treatments. So, what's aphasia anyway? Imagine this, there's a part of your brain that controls language. If the part gets damaged, you might get aphasia. For most people, the area is on the left side of the brain. Aphasia often comes and suddenly, like after a stroke or a head injury, but sometimes it develops slowly because of a brain tumor or another brain disease. So the result, you might have trouble speaking, understanding others, reading, and writing. Sometimes aphasia goes hand in hand with other speech problems like trouble controlling your muscles is commonly called dysarthria, or trouble planning the movements needed to speak is commonly called apraxia of speech. It's all because of brain damage. And then, what causes aphasia? Aphasia happens because the part of your brain that handles language gets damaged. The most common reason is a stroke. When the blood flow to your brain is blocked or a blood vessel bursts, without blood, brain cells die because they don't get enough oxygen and nutrients. Besides stroke, other causes can be a serious head injury, a brain tumor, a gunshot wound, a brain infection, or a brain disease that gets worse over time, like Alzheimer's. And then, what type of aphasia are there? There are two broad categories of aphasia, fluent and non-fluent, and there are several types within these groups. Damage to the temporal lobe of the brain may result in Wernicke's aphasia. You can see the picture list here. The most common type of fluent aphasia. People with Wernicke's aphasia may speak in long, complete sentences that have no meaning, adding unnecessary words and evaporating made-up words. For example, someone with Wernicke's aphasia may say, "You know that model pinker and that I want to get him round and take care of him like you want before?" As a result, it is often difficult to follow what the person is trying to say. People with Wernicke's aphasia are often unaware of their spoken message. Another hallmark of this type of aphasia is difficulty understanding speech. And the most common type of non-fluent aphasia is Broca's aphasia. You can see the picture list here. People with Broca's aphasia have damage that primarily affects the frontal lobe of the brain. They often have right side weakness or paralysis of the arm and leg because the frontal lobe is also important for motor movements. People with Broca's aphasia may understand speech and know what they want to say, but they frequently speak in short phrases that are produced with great effort. They often omit small words such as is, and the. For example, a person with Broca's aphasia may say walk dog, meaning I will take the dog for a walk, or book to table. For there are two books on the table. People with Broca's aphasia typically understand the speech of others fairly well. Because of this, they are often aware of their difficulties and can become easily frustrated. Another type of aphasia, global aphasia, solved from the match to extensive portion of the language areas of the brain. Individuals with global aphasia have severe communication difficulties and may be extremely limited in their ability to speak or comprehend language. They may be unable to say even a few words or may repeat the same words or phrases over and over again. They may have trouble understanding even simple words and sentences. There are other types of aphasia, each of which results from the match to different language areas in the brain. Some people may have difficulty repeating words and sentences even though they understand them and can speak fluently and or commonly called conduction aphasia. Others may have difficulty naming objects even though they know what the object is and what it might be used for, or commonly called anemic aphasia. Sometimes blood flow to the brain is temporarily interrupted and quickly restored. When this type of injury occurs, which is called a transient ischemic attack, language abilities may return in a few hours or days. And then, how is aphasia diagnosed? A doctor treating someone for a brain injury usually first notice aphasia. The person will typically have an MRI or CT scan to confirm brain damage and pinpoint its location. The doctor will also test the person's ability to understand and use language. Things like following instruction, answering questions, naming object, and having conversation. If the doctor suspects aphasia, the patient is usually referred to as speech language pathologist. This especially will do a thorough assessment of the person's communication skills, looking closely at their ability to speak, express ideas, converse socially, understand language, and read and write. And then, and the last, how is aphasia treatment? The brain is amazing at repairing itself after injury. Because of this, many people with aphasia see significant improvements in their speech and communication in the first few months even without treatment. But sometimes some aphasia remains. That's where speech language therapy comes in, helping them communicate more effectively. Improvements can continue for years, and even areas of the brain where the damaged part can become active again. How much someone improves depends on several things like the cause of the brain injury, however, and where the damage is, the person's age, and their overall health. Aphasia therapy helps people communicate better. It does this by using any remaining speech abilities, restoring as much speech as possible, and learning other ways to communicate, such as using gestures, pictures, or electronic devices. There's individual therapy like tailored to each person's needs and group therapy like practicing communication with others. New technologies are also helping. For example, online therapy via computer or apps on tables to assist with speech. And many activities are also available for people with aphasia, such as book clubs, technology groups, or art clubs. These help build confidence and social skills as well as improve communication. Many cities also have support groups for stroke survivors, which can help them and their families adjust to life after stroke and aphasia. Family involvement is crucial for supporting individuals with aphasia. Active participation allows families to learn effective communication strategies. These include attending therapy sessions when possible, using short and simple sentences, repeating or writing down keywords for clarity, speaking naturally as you would to any adult, minimizing distraction like loud TVs, including the person with aphasia in conversation, following their opinions like especially regarding family matters, accepting all forms of communication like speech, gestures, pointing, drawing, avoiding correction of their speech, giving the ample time to speak, and encouraging participation in outside activities and support groups such as church clubs. So, we hope this video has equipped you with practical tools to support your family member. Don't hesitate to seek professional help and connect with support groups. Your active involvement makes a real difference. Thank you for watching. Assalamualaikum warahmatullahi wabarakatuh.